Welcome everyone to another video of Priya Meds. Hope you're all doing well. My name is Priya and I'm currently working as a trust grade doctor in the UK after completion of my foundation training in 2023. I am based in the Northwest region in the UK and today I want to talk about something awesome. Transitioning from FY1 to FY2. Let me tell you, it was a game changer. This video is mainly aimed at current FY1 doctors or medical students who will be soon going into FY1 or FY2. Right, let's get into the video now. I completed my foundation year 1 training in August 2022 and after successfully passing my ARCP, I started as a foundation year 2 doctor in the same hospital. I did 4 months of trauma and orthopedics, 4 months of gastroenterology and 4 months in general psychiatry, especially in learning disability department. During this 1 year, I was still considered as a lift doctor where I spent 1.5 days in GP and 2.5 days in the hospital. Having that extra year under my belt made a huge difference. I knew the hospital environment, the workload, and even how to navigate the hospital computer system. Foundation year 2 is all about stepping up. You are not just completing tasks, you are managing patients. This means using your clinical knowledge, your critical thinking during ward rounds. It's like finally putting all those study sessions to work. Imagine this, you are presenting a patient case, considering different diagnoses and proposing a management plan. It is challenging, but it's super rewarding as well. One of the best things about FY2 is the chance to broaden your skill set. I did a lot of locums and extra shifts, which gave me a wider range of clinical experiences. I even got to assist with procedures like lumbar punctures and chest drains, thanks to amazing senior doctors out there who were always happy to teach. As a lift doctor, I was consulting much more difficult cases with shorter consultation time in GP practice, but I am so, again, grateful to always be able to ask for senior advice anytime I want. The groundwork you lay in FY1 is crucial. Those management plans you practice during ward rounds, they become your second nature really in FY2 when you are clerking patients in ED and making decisions on the spot. Taking advantage of those FY1 teaching sessions really paid off. They also equip you with the knowledge and skills you need to thrive in FY2. FY1 to FY2, it is a step up, but with the right preparation, it's incredibly rewarding. You will build confidence, broaden your skills, and become a well-rounded doctor. For all my FY1 viewers out there, don't be afraid of FY2. It is challenging, but it's amazing. Leave a comment below with any questions you have about the transition. Foundation year 2 brings a whole new world of specialties. I rotated through trauma and orthopedics, gastroenterology, and even general psychiatry. In ortho, I went from textbook knowledge to seeing real fractures. I learned about managing post-operative patients and went to involve senior doctors. We even saw many cool new surgical tools and implants during lunchtime meetings from companies promoting this tool and even in operating theaters. Gastro was intense. I learned about liver cancers, alcohol withdrawal, alcoholic, non-alcoholic liver disease, and even involved in a multidisciplinary teams meeting. We had dietitians, liver nurses, inflammatory bowel disease nurses, heart failure nurses, pharmacists, all working together for the best patient care. I even got to observe endoscopies and iron deficiency clinics. Let's be real, gastro was busy, but sometimes I would observe colonoscopies or attend MDT meetings with other specialties during my free time. These experiences really boosted my clinical knowledge. My third rotation, learning disability unit, was a whole new environment. Ward rounds were once a week, but I learned so much about examining patients with learning disabilities. It opened my mind and eyes to a different side of psychiatry, and I won't lie, it even made me consider it for my future career. In FY2, I had much more complex learning outcomes to fulfill for my portfolio. Some of the examples were like recognize and treat the deteriorating patients using structured ABCDE approach. This approach is crucial in emergency and critical care settings. Throughout the year, I did encounter many cases where prompt assessment was essential. For instance, I recall a patient presenting with severe respiratory distress. So utilizing the ABCDE approach, I quickly identified airway obstruction, provided immediate intervention, and coordinated further care, which was instrumental in stabilizing the patient. Another example of outcome was leading the multi-professional team when appropriate. So during my rotations, I often found myself in situations where decisive leadership was necessary. So I led the ward rounds, coordinated care plans, and facilitated interdisciplinary meetings. One notable experience was managing a patient with complex comorbidities in the ward. By leading the team of doctors, nurses, pharmacists, health workers, I ensured that each professional's input was valued, creating a comprehensive and cohesive care plan that significantly improved the patient's outcomes. This experience did taught me the importance of clear communication and respect for my colleagues' expertise, and also the ability to delegate the task effectively. Eventually, with experience, my confidence level definitely built up. Third example is demonstrating an ability to direct or lead a handover, showing some ability to anticipate problems that may arise and plan solutions to them. I actively participated in journal clubs, attended workshops, and engaged in self-directed learning. This commitment to lifelong learning actually allowed me to apply the most current evidence-based practice in patient care. FY2 life is a whirlwind. You juggle clinical duties, admin tasks, teamwork, and learning all at once. It is demanding, yes, but incredibly rewarding. My weekdays were usually 9 a.m. to 5 p.m., but weekends could involve extra shifts in the emergency department or on the wards. Some foundation year 2 doctors like lift doctors have more predictable schedules. If you are a regular FY2, then you usually work rotating shifts like days, nights, or weekends lasting 8 to 12 hours max. Clinical duties are hands-on. You manage patients from admission to discharge. This includes examinations, ordering tests, interpreting the result, and creating a management plan. You are not alone. You collaborate with consultants, registrars, nurses, and other professionals to ensure holistic patient care. As an FY2, you might even hold the arrest bleed, responding to cardiac arrest and performing procedures like cannulas, blood draws, and CPR. Detailed document is key. You maintain patient records during ward rounds and document clinical decisions accurately. Effective communication is very important. You are expected to deliver clear handovers to your colleagues during shift changes. And learning never stops. As a trainee, you prioritize attending teaching sessions and seminars. You will also complete reflections and maintain a portfolio documenting your clinical experiences. FY2 is a challenging but rewarding year. It equips you with essential skills for your future medical career. Don't be discouraged. Embrace the learning curve. For viewers outside the UK, like me coming from Malaysia, the system might seem different. In the UK, FY2 is your chance to apply for specialty training. By your second FY2 rotation, you will get notified about applications for the following year. Usually, that's around November or December. Unlike some other countries, there's no gap year between the foundation year 2 and the specialty training. If you get accepted, you start right away. Keep that portfolio updated. It's crucial for applications, especially in the UK with a shorter foundation program. Not 100% sure what specialty you want? That's okay. FY1 and FY2 offer a ton of educational opportunities. There are so many doctors out there who take a year out, work in different countries, or do extra locum for a year before getting into training as well. You do get a taster week as part of your foundation training, which you can utilize to explore specialties you haven't experienced during your rotations. Don't neglect other educational opportunities like your lectures, workshops, conference. They will all strengthen your application. Foundation year 2 can be overwhelming, but the specialty applications are manageable. Start planning early, utilize the resources, and don't be afraid to explore. Leave a comment below with any questions about specialty applications in the UK. Let's help each other out. Right, we are diving into the survival tips for FY1 and FY2 doctors. Because let's face it, these foundation years can be wild. Feeling overwhelmed by shifts, exams, and to-dos? Don't let the chaos week become a master of organization. Use a planner or digital calendar for shifts, deadlines, and study sessions. Make to-do lists and prioritize ruthlessly. Trust me, your future self will thank you. You are not alone in this journey. Connect with your fellow FY1 or FY2 doctors. They get it. Share tips, vent, and celebrate wins together. Don't be shy. Seek help and advice from senior colleagues and your mentors. Their experience is gold. 3. Take care of your well-being, make time for regular exercise, eat a balanced diet, and ensure you are getting enough sleep. Tip number 4 is to be proactive in your learning. Take charge of your education by seeking out learning opportunities. Attend teaching sessions, ask questions, and take advantage of online resources. Use your e-portfolio to document your progress and reflect on your experiences as well. 5. Effective communication is key. Whether it's with patients, colleagues, or your multidisciplinary team, clear and concise communication is vital. Practice active listening to be clear in your instructions and don't be afraid to ask for clarification if needed. Feedback isn't a bad thing. It helps you improve and grow as a doctor. Seek constructive feedback and use it to become the best doctor you can. Your supervisors are there to guide you, so don't be afraid to ask questions, seek advice, and build a positive working relationship. Leave a comment below with your best FY1 or FY2 survival tips. Let's share the knowledge. Right, here we are. If you found these tips helpful, please give this video a thumbs up, subscribe to my channel, and hit the notification bell so you don't miss out on future contents. Thanks for watching and good luck on your journey.